Today we will discuss about one more topic, infertility. So what is infertility? Infertility is a situation in which regular unprotected intercourse does not result in a pregnancy over a 12-month period. Means when after the marriage, when couple is deciding, let me have a child. So every month during the fruitful time, when they try to have a child without using any unprotected devices or yes, any condom or anything, but they are going on, though they are trying also, if the lady is not getting pregnancy, the situation is called not 1 month or a 2 month they are trying and saying it infertility, continuously over 12-month period, means 1 year, if the lady is not getting pregnant, the situation is called as a infertility, means inability to have a child or inability to conceive. So what may be the causes or a risk factor for infertility? The female infertility factor, 30% of the female infertility factor contributing, then male factor 30%, combined male as well as a female 15%, and unexplained, because for the present technology the causes are not getting at all, what doesn't know only, that is at 25%. Okay. See, when infertility, when the lady is not getting conceived, the immediately blame always goes for the female only. Oh, okay, might be the lady is having some problem. So nobody are think about the men also. Even in a man also having the problem. So the problems are usually equal, either in a female woman or in a man. So, male factor, let me see what all the male factor contributing in a infertility. Low semen quality. So, what is semen? Semen is a kind of a white liquid produced by the male reproductive system. So, in that semen itself, in that semen itself, the sperm will float. So, this semen, the quantity should be a normal. If it is in a low quantity, of course, it will cause us infertility. Low sperm count, usually the normal sperm count should be there, so that much the sperm count should be there. If it is very less sperm count, of course it is not helping for the conceiving. Hormonal imbalance, hormonal imbalance in a both also, okay, male as well as a female. So now here male related we are studying, that might be a testosterone, androgen or other hormones. Congenital abnormalities include torsion, varicocele. Torsion means twisting. So male genital organ we saw, many tubes are there. Epididymis, vas deferens, so all that, spermatic cord. So if any of the tubes are twisted means, of course the sperm cannot move normally. Varicocele, dilated vein inside the scrotum. So all this disorder I discussed in my previous video. So you can go through that, okay. Cryptorchidism, undescended testes. If testis is not descended to the scrotum, because testis will produce testosterone. So very important. Testosterone is helpful for the production of sperm. So undescended testis. Congenital blockage of vas deferens. So means that is one, in a vas deferens the sperm will move. Even this. If in case it is a blocked means even the semen as well as the sperm cannot move properly. It is blocked. Retrograde ejaculation, in case of a forward move, there's a backward movement takes place. Exposed to substance known to interfere with the spermatogenesis. Spermatogenesis means mature sperm in the testis. Then only if a mature sperm is there only, it helps for the conceiving. So the sperm, it is a male reproductive cell. So that cell is not maturing only, immature size only, due to exposing to various kind of a chemical substance in the form of eating or in the form of like exposing, working in a chemical factory and all. Okay, now let me see the female factor. Absence ovulation means a release of mature egg or ovum from the ovary. So, anovulation it is called. Anovulation means the ovulation is not taking place only. The egg is not maturing only. So, the fertilization may not take place. Fallopian tubal obstruction. So you will study this female genital organ properly in a third year, might be obstetric and gynecology. So the fallopian tube is there, left and right sir. Through the fallopian tube only this sperm will move and a ovary, this uh, egg will come and a union will takes place. If that tube itself blocked means the sperm cannot move. So there's a fallopian tube obstruction due to any kind of a blockage of there's a growth or any kind of ulcer, all that things. PCOD, polycystic ovarian disease, means many cysts in a ovary. So ovary will produce, right, eggs in the like follicles, everything. So it cannot. Uterine and cervical factor related to uterine and cervical, any fibroid, cancer or a structural abnormality, the anatomy is altered. Infection of reproductive system, it might be a sexually transmitted disease, chronic pelvic infection, various, if the lady is undergone, the woman is undergone for various reproductive related surgery or abdominal surgery or a various kind of surgery, may also interfere in a conceiving. Endometriosis means what? Abnormal tissue growth in the uterus. So when abnormal tissue growth in the uterus means when it is removed also again it will regrow. Okay, so there will not be for the development of baby and all, there is no place in the uterus. Okay, so the uterus will not give the chance or a space for the conceiving. Too much prolactin reduce estrogen production, means if too much prolactin is there means ultimately it will reduce the estrogen level. So when estrogen level is reduced, conceiving will not take place. Pituitary and hypothalamic dysfunction, because in a hypothalamus is a part of the brain, in that pituitary gland is the pituitary gland will produce a luteinizing hormone, all that things, all other female related hormones. So that hormone will not produce in a proper amount. Advanced maternal age, if the maternal age is advanced means it is a crossed 35, 40, 45. So after the late, if trying to conceive means it is difficult. What are the combined factor in, yeah, means in a both also, male also, female also, some conditions are there, due to that the lady is not conceiving. Diabetic mellitus, either one person or both are also suffering. Hypopituitarism, thyroid disorder, hypothyroidism or a hyperthyroidism, adrenal tumor, adrenal related disorder, cirrhosis of the liver, damage of the liver, continuous urinary tract infection, cystic fibrosis, endocrine dysfunction, because endocrine, you know, various glands are there, it will produce hormones. So dysfunction, it is not properly producing the hormones. Habits like smoking, drinking tobacco, chewing, it's not only meant for the men. Okay, even these days females are also addicted for this kind of habits. Drug intake, it may be in the form of tablet or a cocaine, marijuana and many other. DNA damage, immunological and a genetic factor, immunological disease, genetic factor, genetic disorder, occupational hazards like working in a chemical factory, stress, over stress, means that due to that stress, entire the hormonal production, everything is altered. Psychological factor means mentally unsound. Combined, these all are combined in either in a man is having, or in a woman, or in a both are also having this problem. Due to that the lady is not conceiving, or the man is unable to give child to his partner. What are the diagnostic studies? See, for 1 year if they try to have a child, when lady is not conceiving, immediately the couple has to approach the obstetric and gynecologist doctor, and they will do thorough in proper history collection with the thorough investigation. Then only the causes will come to know. According the causes, the problem will be treated and helping the couple to have their own child. Assessment, detailed history and physical examination for both the partners, man as well as a woman, diet pattern, habit, occupational history, sexual history, whether they are having during the fruitful time or what, occupation, where they are working in a chemical factory, diet, whether vegetarian or non-vegetarian, habits like smoking, drinking, drugs taking, medical and surgical history, suffering from any kind of a disease, undergone for the surgery, reproductive history, age of puberty, whether the lady is getting at a proper time the menstruation every month, whether she is getting ovulation or an ovulation, possible sexually transmitted disease, whether they are suffered or still is on. Basal body temperature means whether it is in a normal or is in a very high. If it is a very high means, of course, the egg as well as a sperm cannot survive. So that is also should be in a normal. Okay, for male, what all the diagnostic investigation carried out? Thorough physical examination, presence of testicles, whether both the testicles are present in a proper place in a scrotum or any one, or an absent testicle. Any kind of a male reproductive related problem. Already I have taken all the classes in my previous video. You can go through. There's a varicocele, scrotal and a penile abnormality like epispadiasis, hypospadiasis, and many other. Post-ejaculatory urine specimen. So after the ejaculation of a semen, so the urine is collected to check in that urine sperm is present or not. Semen analysis. The semen is collected immediately after the collection itself. It has to send to the lab. It cannot be kept in a ward itself. Okay. So the sperm death will take place. It is very fragile. It will not survive for the outside temperature. So immediately collection, it has to send to the lab. Okay. That is a viscosity, number, concentration of a sperm, is a mobility, whether it's a moving, whether it is in a very good condition, anatomically, whether it is in a normal condition, presence of white blood. So all this will be studied. So if anything is a lack means immediately based on that the treatment will be started. Okay. Ultrasound is done in case if still more, if any major, if doctor get the doubt, CT scan to find out anatomical abnormalities and other. If the organs are not in a proper anatomy, any like a malfunctions are there or a malformation is there means to find out. Serum endocrine studies assess the testosterone, prolactin, luteinizing hormone and follicle stimulating hormone. So these all the investigations are carried out for the men. In the same way for the female, detailed history collection and physical examination, blood test, that is a serum hormone level, luteinizing hormone, FSH and prolactin. Pelvic scanning will be there. Urinary luteinizing hormone test will be there. Thyroid function, thyroid profile, the T3, T4, TSH will be done for both also, okay, men as well as a female also. Diagnostic laparoscopy means the visualization of the fallopian tube and a uterus, everything is done in order to know whether it is in a proper condition or any fibroid is there or any tubal blockage is there. Ovulatory studies. Every month after the menstruation on the 14th day, this ovulatory studies will be done to see the egg size, whether it is a maturing or not maturing. That will be noted down. Tubal patency studies, whether tube in a proper condition or any blockage is there. Follicular studies, how many follicles are there, whether size of the follicles. Endometrial biopsy. Hysterosalpingogram means an X-ray study of the uterus and a fallopian tube in order to know any abnormalities. So all this examination will be done for the couples, both also, okay. So based upon problem, both are also treated. Might be sometime the problem will be in a only female or problem will be in a only man or problem will be in a both couple. So depend upon the it will be treated. Depend on the cause. For male, testosterone hormone may be prescribed. Testosterone patch application directly to the scrotum. Treatment for male sexual dysfunction. If the sexual act between the couple is not proper means sex therapy. The therapist will be guide them and counsel them. That is a couple counseling. Surgical removal of the pituitary tumor, surgical correction of a varicocele, cryptorchidism and other congenital disorder will be done. Correcting ejaculatory abnormalities, obstruction by split ejaculatory technique means the ejaculation should be a forward, not the backward. So that malformation will be made it proper. Okay. Retrograde ejaculation treated by some of the medications. Immunological causes treated by steroid. Okay, if any immunology disorder means by steroid to reduce the infection, inflammation, it will be treated with a steroid. Antimicrobial drugs to treat the infection. Advising the client to avoid factors that depress spermatogenesis, such as a heat, taking bath in a very hot water and wearing very tight dress, underwear and all, or taking drugs, alcohol, marijuana, smoking, everything has to stop if the couple want the child means. Keep the testicle cool by avoiding hot bath as well as a tight cloth. It has to be given education. Many they doesn't know. Good nutrition, that is especially green leafy vegetable, and egg can be taken, fish can be taken, but non-veg can be taken, but not in a every often, once in a while it's okay. Mental health, that is very important. Yoga, exercise, meditation, reading, recreation, going out, wife and husband together, enjoying, so all that things. Okay, depend upon a cause for the female. Hormone supplement therapy, drug therapy, antimicrobial for pelvic infection, fibroid removal, if the fibroid is there, tubal blockage is there, means making it proper, removing the blockage. Good nutrition, there's a green leafy vegetable. Mental health, as I said, exercise, yoga, meditation, going outside. Proper treatment for the medical and surgical disorder. If all these cases are, means if normally if the lady cannot conceive, means there are other procedure also is there, that's the intrauterine insemination. What is intrauterine insemination? It is a medical procedure whereby an egg is fertilized by sperm in a test tube outside the body. So after the fertilization, then later it is inserted to the biological mother, means that lady's womb. So the growth will take place, but it is a success rate is only 50%. Some may succeed in a one attempt and some may require several attempts. Okay, and it costs nearly 3.5 lakh, 3.5 to 5 lakh. If that is also not possible, if the lady's uterus is completely damaged, means surrogate mother. Surrogate mother means borrowing the uterus of someone temporarily, means same like IVF. First IVF, fertilized outside the body, means in a test tube, then inserting that fertilized product in a rented womb. So that is, it is a legal procedure. Okay, so after the birth, the lady has to hand over child to the biological mother, and it costs us a 15 lakh to 20 lakh. So those are capable to go for this. Capable means it financially it is a very expensive, but some they go for this. So these are the two methods are available. Okay, what are the nursing management? As a nurses, what is our responsibility? Providing information on anatomy and physiology of male and female reproductive system. Sex education, like a methods, fruitful period. Many females and men they doesn't know. Fruitful period, when is a fruitful period and when should have a like a fruitful sex. Emotional support. Education on prevent infertility by avoid gonadotoxins, drugs, alcohol, tobacco, steroid, and smoking, drinking, all that bad habits. Avoiding occupational and environmental hazards like exposing to chemical and male, especially for the man, keeping scrotum cool by avoid hot bath and a tight cloth. These education has to be given. Avoid multiple sexual partner for both also. The blame cannot, we cannot tell only for man, even female are also. For both we have to educate. Balanced lifestyle, rest, sleep, nutrition, everything should be the balanced lifestyle should be there. So hope student you understood about infertility. So some of the point like surrogacy and IVF, if I'm going to explain, means more than 1 hour it goes. In the next year, in a third year, you will in obstetric and gynecology, you will get a proper explanation. Okay, but here in under medical surgical, this much information is enough for you. Okay, thank you. For the nursing management, you have to refer the book.